Okay, it's 9:30 and we have quorum. So I'd like to say good morning to everyone. Thank you for coming out to this meeting. And I would like to call the meeting now to order. I note that Member Sicoli and Member Martin were going to be joining. Member Sicoli is going to be a bit late, but we do have quorum now. So, and Amy just joined, so we're good to go. Okay, any conflicts of interest to declare by any of the members? Not seeing any. Okay, then we'll move forward to approve the agenda. Can I have a motion to approve the agenda? Kim and John Bell, thank you. All those in favor? Okay, that's carried. Okay, so then we note that we don't have any delegations, so we'll move forward to the standing reports, number 5 on our agenda. So I just have a short verbal report here for everyone. First of all, I wanted to thank Member Martin for her role as chair last year. Thank you for your leadership in the past year. We really appreciate it. We also note in our consent items, we have the motion or the resolution from Norfolk County that Tom Michelli will step in your place during any leave of absence. And you will still receive all the circulation of that. But if and when you're able, we are more than happy to see you here, and we'll be happy to have Tom attending in your place in the meantime. And wish you all the best and hope everything goes very smoothly for you. And then in our consent items, you'll note as well, we received the resignation letter from Mayor Davis, and the city will be appointing a replacement on February 24th. So we'll wait to hear from them on that. And then I had sent out an email earlier last week. Jason, we were pleased to see your formal appointment and want to congratulate you again on that. We're looking forward to working with you and we're excited for that progress for you. And then I did attend the Alpha virtual conference on Friday. There was a very good topic on risk communication. They had indicated that their slide deck would be shared. And if that becomes available, I think that would be a good one just for the board to receive and our senior leadership team. They spoke a lot about also differentiating between hazard and risk, and in our messaging to ensure that a hazard is the potential harm, but risk is really bringing home the message of the likelihood of that hazard becoming happening to you and the harm and consequences of that hazard and to an individual and to our audience. So that was one of the things key things I took home from that is like, when we're doing our messaging, it's good for everyone to know about the hazards, but let's make sure we're bringing home what that likelihood is to our audience and what the consequences are. And I think we've been working hard on that, and continuing in that is important. And then Dr. Moore, our Chief Medical Officer of Health, was there as well. He had some highlights, encouraged us to use the draft new Ontario public health standards in program planning. He indicated he doesn't anticipate much change from the drafts that have been shared, but wouldn't give a timeline as to when those formal ones were coming up. And then the other interesting note, he talked about some of the funding and the need to also be advocating for that with the ministry. And he also noted that the premier and cabinet seems to be very data driven. So they want to see numbers showing results for programs and basically being able to substantiate with data what our programs are delivering. The difficulty on that, sometimes that's delayed. So it's really for us to manage those expectations about that timeline for results. And then there was a topic, legally speaking, that was of interest that really went over the responsibilities and duties of board members. And Alpha actually has their under their shared resources on their website, a paper there that actually goes through a lot of those risks for us as board members and what our duties are. And it would be prudent for all the board members to review that. I have that and that paper, and I don't mind circulating it after the meeting if there's interest for that. So, any comments from board members? Member Bell?
Yeah, thank you, Madam Chair. I too sat in that winter symposium. I think you covered all the things that I would have covered. But the day before, I sat in the Alpha board meeting, and if you will oblige me, I'll just give a few highlights from that.
That would be great. Thank you.
Yeah. So you've already mentioned that Jason has been confirmed. Kieran Moore confirmed that all medical officers of health appointments had been passed on by the Ministry of Health. So Jason got his due regard, due reward. Everybody else was with him. He mentioned there would be some delays on wage harmonisation. I don't know whether that's filtered through to Sarah and to Brad, and maybe you can touch on that later in the session. To your comment about data, Kieran Moore said that the Ontario Health Data Platform is high on his agenda, and I guess that just reinforces your comments earlier. What was a little troubling, I heard, was a review of governance in public health. And I wrote to the chair and to Jason and to Sarah just to let them know that this has happened. I don't know where it's going. I don't know what's prompted it. There are some local issues that have hit the headlines, but I don't think that's particularly related to this one. But it does give me some cause for concern that the promise that we had in the early part of 2024 that any savings we could find in a merger we could reinvest, it's kind of morphing into, if you can find any savings, that's great, that's efficiency, we'll take it. So I pushed a little bit with Kieran Moore about the budget side of the modernisation of public health, or the funding model part of it. He was non-committal. It seems to be going backwards, and this review of governance seems to reinforce my concern that it is not as black and white as we had hoped it would be. He also mentioned, and it's on our agenda a little later, that he and his colleagues are pushing, or the ministry is pushing for labelling of alcohol. We'll come back to that, I think, in section 9 of today's agenda. And just to reinforce on the Ontario Public Health Standards, he confirmed that everything was likely to be unchanged except for harm reduction. And that seems to be more of a political agenda item than a health agenda item, which I think we can all understand. Thank you for giving me the time, Madam Chair.
Thank you, Member Bell, for those comments. Appreciate that. Any others with comments? Member Martin?
Thanks, Madam Chair. Any comments on why the delay if we're going to go back to the draft standards for preparations?
The only speaking on that was that the ministry was doing a deeper dive into the harm reduction standards, and that was causing a delay across the board but that's the extent of the information that they provided. Any further comments? That's my report. We just received that for information, right, Nicole? And do we get a motion for that?
Yes, please.
Okay, so motion to receive for information. Thanks, Member Metcalf, seconded by Member Martin. All those in favor? Carried. And then we'll move into section 6 of our agenda here. And we'll be starting with 6.1, Food Insecurity Report. Welcoming staff here, Laura and Lisa. Thank you for attending. We'll have your report.
Good morning, Madam Chair, and through you to the board. Thank you very much for having myself, Laura Goyette, and my colleague, Lisa Vermeersch, here today. We're both registered dietitians with Grand Area Public Health. And we're here today to present on food insecurity in our region. In today's context, we define food insecurity as inadequate or insecure access to food, and this is due to a lack of money. When we report on our statistics about food insecurity, we are including a range of severity, including marginal, moderate, and severe. Marginal food insecurity is when a household may worry about not having enough money for food or have decreased selection. With moderate food insecurity, we see that there's starting to be compromises in quantity and or quality of food. And with severe food insecurity, there's a decreased intake of food with these households. And at the most extreme, these households are going days without food. Food insecurity is a public health issue because many of our broad messages promote consuming a nutritious diet because of the health implications of doing so. But we see year after year that many households lack the financial resources to implement these recommendations. And there are increased health risks with being food insecure at every level of severity. Adults living in food insecure households are at an increased risk for the development of chronic diseases, including heart disease, high blood pressure, and depression, among many others. They're also at an increased risk for premature death. So locally in our region, 25.4 or 1 in 4 households were food insecure in 2023 and 2024. And this is the most recent statistics that we have. You can see in the graph below that compares our region to the province that we are very similar to Ontario. This is not just an issue that's happening in our region. It is across the province and really across the country. But what you will note is that this trend appears to be getting worse. In 2024, rates of food insecurity in Ontario were the highest recorded since Statistics Canada began collecting this data in 2005. So the situation is very severe. Unfortunately, households with children are impacted even worse than the general population. So in 2024, we saw that 1 in 3 children in Ontario were living in a food insecure household. And from a health perspective, we see that this increased the risk for hyperactivity and inattention. Children living in severely food insecure households, so that's that category where there may be missed meals and reduced food intake. We see that these children are at an increased risk of depression and suicidal ideation later in life. The Canada Child Benefit is an example of a policy intervention that has been successful in reducing rates of severe food insecurity in households with children. It was implemented as part of the 2016 Federal Poverty Reduction Strategy. And what we saw that once it was implemented, low-income households with children saw reductions in severe food insecurity by a third. So this is a very powerful tool that we have. The way that this benefit works is it targets low and moderate income families. And families with children under 6 receive additional benefits that appear to be protective of food insecurity. However, once a child turns 6, those benefits are reduced. So you will see in our Board of Health report today, we have a recommendation for your consideration related to the Canada Child Benefit and modifications that can be made to this benefit to make it an even more powerful tool to target food insecure households with children. So how do we address this problem? There really has been a shift in how we address this issue over the past 10 to 15 years. We used to think that this was a food issue and we would address it with food solutions that were often possible at the local level. But through evaluation of our programs and additional research, we now know that this, while those programs have lots of other benefits, they're not successful in reducing food insecurity. So now what we do focus on are the root causes of food insecurity. And we have lots of evidence that supports what we call income responses. So essentially interventions that will put more money in the pockets of households that don't have enough money to buy food. We have so many incredible organizations across our region that work in the food charity model. So this is food banks or meal programs. But if we leave this as the sole solution to addressing food insecurity, we'll likely see these rates continue to worsen. So public health works upstream. So what our interventions are really trying to tackle is preventing households from ever needing these programs.
So as Laura mentioned, Grand Erie Public Health is focusing our work on the root causes of food insecurity. We do this by monitoring local food affordability using the Ontario Nutritious Food Basket Survey tool. And this guides our public report and our municipal primer. We also conducted focus groups for people with lived experience of food insecurity. And Grand Erie Public Health also uses a food insecurity lens throughout our work and programs. So for example, by providing nutritious snacks and food at drop-ins, considering that people that attend these programs may be experiencing food insecurity. So the Ontario Nutritious Food Basket Survey is a tool that is used by health units across the province to monitor the affordability of food. It is mandated by the Ontario Public Health Standards in that the boards of health are required to monitor food affordability at the local level. We do this by using the ONFB survey tool across grocery stores in our region. You can see an example on the slide of a few produce items of the 61 total items that are a part of our survey. And in May 2025, the results of our survey revealed that the average cost of a nutritious diet for a reference family of 4 in Brantford Brant was about $1,208 per month, and in Haldimand Norfolk was about $1,176 per month. So this portion of our work only captures food cost as a snapshot in time. However, to look at how affordable food is, we have created income scenarios. So using this food costing data from the Ontario Nutritious Food Basket Survey, we have created 10 income scenarios for each of Brantford Brant and Haldimand Norfolk regions, which can be found in our public report. And in these income scenarios, food cost data is analyzed in relation to income and rental costs to determine whether food is affordable for different household types with different income sources. So the screenshot on the slide from the public report does highlight an example of an income scenario of a single male whose income source is Ontario Works. So using local rental data, we can see he would be spending 154% of his income on rent and 47% of his income on food. So if he were to pay for both rent and food, he would need an additional $907 per month. We understand that people living in food insecure households will typically prioritize essential needs like housing over food. So this situation is worsening year after year for those on social assistance, with Ontario Works being the most significantly affected. So we do encourage you to take a detailed look at these income scenarios to see for yourselves how difficult it is for many to be able to afford a basic nutritious diet. And remember that these scenarios do not even include any other basic expenses like phone or internet bills, transportation, shoes, clothing, or any other household supplies. So to include the voices of people who have had lived experience with food insecurity, Legacy Brant County Health Unit staff conducted 3 community-based focus groups in 2024. The key themes from these focus groups are outlined in our public report, but to highlight a few findings, many participants felt that contributing factors to food insecurity included the high cost of food and housing, difficulty finding employment, and inadequate social assistance rates. The belief that an increased income would allow for more personal food choices, like more fresh fruit and vegetables, amplifies the reason why income solutions are crucial to improving household food insecurity. So the public report includes local food insecurity rates, food affordability data with income scenarios, and the results from the focus groups. So the goals of this report are to share this data with our community partners that can be used for funding applications and program planning, and also to raise public awareness on this important topic. So the municipal primer contains evidence-based strategies that municipal staff can implement to target food insecurity and make life more affordable for residents in the Grand Erie Public Health region. The goal is for public health to collaborate with municipalities and to tackle this issue together. So the report and primer will be promoted through a press release, publication on the website, and coordinated social media outreach. So you will see that we have included an ask in the Board of Health report related to endorsing and sharing the municipal primer with the municipalities within our Grand Erie Public Health region.
So in summary, we have included recommendations at all levels of government for the board today to consider to address this issue. At the municipal level is the endorsement and sharing of our municipal primer. At the provincial level is sharing our food affordability data that demonstrates the need to increase Ontario Works rates. And at the federal level is corresponding and encouraging the expansion of the Canada Child Benefit. On the next slide, we have our formal asks for your consideration, but at this time, we would be happy to answer any questions or hear comments. And thank you very much for having us here today.
Thank you very much for that presentation. Appreciate that, your time and effort into that. And then just looking at the board, are there any comments or questions from the board? Member Huffman?
Yes, can you hear me okay?
Yes.
Okay. I just want to say that this report was extremely well done, and it brought to light, a lot of issues that I know that members of our community have been struggling with. Now, I just wanted to be assured that when we're talking about the expansion of the Canada Child Benefit, that we're looking at an age expansion, because I know that when children reach the age of 6, those benefits change. And I'm sure any of us who have fed any teenagers, especially teenage boys in our house, they can certainly consume a lot of food, and they need to for their health and well-being. So does that include the expansion to age? I just wanted to confirm.
So through the chair to Member Hoffman, Yes, you are correct. So the second part of that ask is equalizing the benefit for low-income families with children over 6. So that would be specifically targeted only to those low-income families, but once the child turns 6, to continue those additional benefits.
Okay.
The first part of that ask is increasing the amount for lowest income households, as we see that we only saw a reduction of a third for severely food insecure families, which ideally I think this benefit would reduce that amount by even more.
Okay, great. Thank you very much for that confirmation.
And Member Martin?
Thanks, Madam Chair. I'd like to echo Member Huffman's comments. This is by far the most comprehensive and best data-driven report that has been before Grand Erie Public Health to date. No shade to our other staff. I see the reports all coming together. They're really, really great, but this was outstanding. So thank you for that, and timely based on the announcement we heard this morning about the province wanting more data. A couple questions. You touched on social media. That was one that I wanted to touch on for sure. Pumping out some information about the income scenarios and the CBC is critical, I think. The income scenarios, do we base, or do you have any information based on home ownership, given the strict or the steep change in prices and home ownership, dollar values of appraised values of homes is what I'm trying to say? Are they all rental?
Through the chair to Member Martin, thank you for that question because it's an excellent question. All of our income scenarios are based on rental rates. So you're correct, there isn't anything with home ownership. We do have data that owning a home is protective of food insecurity. However, as we've seen with housing, that is something that could change over time, and so we're keeping a close eye on that. But you're correct, we only do have that data for rental and not home ownership.
Okay, and then just a suggestion as you move forward, great idea on the municipal primer. So maybe you look at what MPAC has assessed the home values at. There hasn't been a recent reevaluation of MPAC homes. So quite often you'll see the municipalities put out their property tax increases and it's based on a $240,000 home, which we know is not the average rate, but it would be a steady baseline that would be consistent amongst all the municipal partners if you were to look into home ownership data and food insecurity. My next question for you is on the Indigenous calculation, knowing that they're specifically at risk, how do you calculate that between Brantford, Brant, and Haldimand, Norfolk? Do you give it like the reserve, does that get allocated to Brantford Brant? Is it broken up because of Hagersville and some in Haldimand? How do you calculate that between the two legacy units?
The chair to Member Martin. So currently our data source is the Canadian Income Survey, and so they do not collect data on reserves. So this is specific to Haldimand, Norfolk, Brantford, Brant regions.
Wow.
So we don't have great data when it comes to those numbers. So we rely on provincial data when we're speaking about higher rates of food insecurity with Indigenous populations.
Okay, so through you, Madam Chair, to the board, if we endorse this, the recommendation from staff, I think all of the information should include that this is separate from Six Nations Reserve and that information is not readily available to us. So as we're advocating to the province and the federal government, they should know that that's not accounted for. And then my last question is, do we do any coordination with Haldimand Norfolk Reach? Like, I know that they are scattered throughout schools for nutrition programming, but how can we make sure we're working with a partner that's already out in the community with food and making sure we get the food into the right mouths?
Good.
Through the chair to Member Martin. Haldeman Norfolk Reach is an excellent partner that Grand Erie Public Health has. They are they hold the funds for the the Child Nutrition Network, which at the health unit we partner with them. We have a dietitian who works with them to help implement our snack and meal programs at schools. We also partner with Well Baby programming through Early On. That Reach also runs that programming. We sit on community coalitions with members from Reach, so we do have strong connections there. But we are sharing this data. When we share it with community partners, we share it with partners, including Reach.
Okay, so just as a follow-up, is there anything we're not doing that we should be doing? Is there something that board members should be going back, specifically Haldeman and Norfolk board members, to our municipalities to make sure? Like, I know they go into the schools and they obviously can't say, well, you get a snack and you don't get a snack. But is there a gap here we should be filling, knowing that we're 1 in 4 households? We already have a program established in half the region. Is there anything that comes to mind on advocacy for that area?
Through the chair to Member Martin, I know that we do support with data and with staffing, but those are conversations that we could have with our partners to see if they're having, because they do run that program, if there's any challenges that they are experiencing that we can further help support them with.
Okay, put some thought into that, and maybe it's just an information memo back to the board. It's only applicable to half the board, but if Haldeman Norfolk's already running the programming and we can take something back to our municipalities and ask for support, you've got a really good foundational report here that I think would help us. So thanks, that's all I have.
Thank you, Member Martin and Member Bell.
Thank you, Madam Chair. To Laura and Lisa, what a very good report. The data is convincing and in many respects quite frightening. The example you gave of the single man who relies on ODSP, doesn't have enough money just to pay even for his rent, let alone to buy food. And the thought of parents having to forego their own meals in order to provide food for their children is terribly unsettling. So great start. I would like that we give this report to our local MPPs. Some of you may or may not know. I'm not sure. I think I'm probably the only, or maybe Mike Bodner remembers, but we did have a report on food insecurity a couple of years ago at the Brant County Health Unit, and it was very much disparaged by the local press and the local MPP. In fact, it led to quite a nasty situation where our former medical officer of health was almost accused of doing something that she shouldn't be doing. She was basically told indirectly by the local MPP, you shouldn't be advocating for these things. It's in contravention to the guidance from the Ministry of Health. It is not. This is exactly what our medical officer of health and his team should be doing. So full marks for that. But I think we do need to use our local MPPs, get the message out, because a lot of the issue around income is related to Ontario Works and ODSP. This is a message we've been given them back through the Social Services Committee that supports the City of Brantford and the county. And I dare say that's been exactly the same from Haldeman and Norfolk councils. I'm glad we're going to share this in the local media. This needs to be headlined. I think we also should share with our local food bank organizations like the Salvation Army, just to give them some comfort that we're on the same side, we're working with them. It is going to be a challenge, I think, to have the municipalities work practically with this. And Amy's question about what more can we do is a very good one. I would like actually that we make this presentation to the municipalities, give it directly, Maybe in the case of Brant County and the city, we might use the Social Services Committee, and I can lobby to have that put on the agenda. It really does dovetail with the issues we have there on pushing for more affordable housing, which would, on the income side of this issue, be equally helpful. But once again, a super report. I'm very happy to endorse it.
Actually, I just have one more thing.
Thank you, Member Bell. Member Huffman, did you have something further?
Yes, I did. Thank you, Chair. I just wanted to add, because of the strong correlation between the housing aspect, I was just wondering if we could also share this report with the Haldeman Norfolk Housing Corporation, and they can maybe use it in terms of some advocacy in terms of housing funding.
Thank you for that, Huffman. Okay, so we have these recommendations. Do we have a motion for that, Member Martin?
Thanks, Madam Chair. I'm happy to move the staff recommendation with just a couple additions. Where it speaks to correspond with federal and provincial government. However, the clerk would like to word this in addition that those correspondence include information that Six Nations Reserve has not been accounted for, and that we know that the Indigenous population is particularly vulnerable. Also to add in that the report be circulated unless it's a no-brainer to staff and they already do this, but with the community partners to local food banks, Haldeman Norfolk Housing Corporation, and that staff be directed to connect with municipal partners for a primer presentation.
Thank you for that. Were you, Councillor or Member Bell?
Yeah, thank you, Madam Chair. Just to add to Amy's list of additions, that we circulate or that we share this with our local MPPs.
Okay. Give Nicole a minute here to add that into it.
If it helps, Nicole, that.
Sorry there.
Yep, that one's good, and that you can remove that staff be directed, because we can put that one at the bottom, copy and paste that, save you the trouble. That the Board of Health endorse, yep, perfect. And back up to correspondence. Board of Health correspond with provincial governments, including local MPPs. Third one down.
Okay, you should be good now.
And then the next one down, local MPs. And then a new line after that one. And that both correspondence include specific notice that Six Nations Reserve has not been accounted for due to provincial or federal, I guess that's probably more provincial, I'm not sure, accounting. I don't want us to get in trouble for that when that motion goes public. So staff, can you help with that? What did you say, Laura? You said the
Canadian Income Survey does not collect data on reserve.
Canadian Income Survey. That includes our partners, our food banks, our MPPs, our MPs. I think we're good.
And did we get the, yeah, we've got the presentation part in there. Perfect. Okay, and we need a seconder for that.
Madam Chair. Madam
Yes.
Chair, if I may interrupt, Member Bodner's had his hand up for quite a while now.
Oh, it's not
I don't know
showing
if
up on
he's,
my.
Yeah. For some
Okay.
strange reason, I don't have the hands up feature on my
Oh,
my
sorry about that.
device. Anyway, I just had a couple of questions for you, Madam Chair. Does Grand Erie Public Health track the food insecurity right now during this year? And if so, how often?
And Laura, are you able to take that question?
Yes, through the chair to Member Bodner. We we're actually very lucky in our province that we have food insecurity data collected annually now through this Canadian Income Survey. However, there's a delay in when we get access to that information. So currently our most up-to-date information is 2023 to 2024. But because StatsCan implements the survey on an annual basis, we, for the foreseeable future, will continue to have data. There's just a lag of 1 to 2 years.
Okay, and if I may, I just had another supplementary question for you, Madam Chair. Will this report be distributed to all municipal candidates throughout the catchment area?
So my understanding is we'll be circulating it through our municipal partners and that information will be publicly available. We won't have a direct route to do it to any municipal candidates, but it'll be available publicly. So, Member Martin.
Thanks, Madam Chair. Great answer. Can we also, I just lost that. Include direction to staff, maybe to Dr. Malenfant. Do you want direction to staff to look at housing prices through MPAC, or can that just be a part of maybe the next report as they go?
The chair to you. We can have an internal discussion and let you know, but probably as of now, plan for the next report.
Sure, as long as that just gets kind of looked at, I'm fine. It doesn't need to be in the motion, but okay, thank you.
Thanks.
Member Bodner, did you have anything further? Sorry, it sounded like I cut you off there accidentally.
Thank you, Madam Chair. No, I was just going to suggest that seeing that we're going to have a municipal election this year, that would be an excellent question to have the moderators at Rogers 20 or at other community events to ask the question about that. Thank you.
Thank you for your comments. Okay,
Madam
so
Chair,
yes.
if I may, I know there's also another reservation as well as Six Nations and Mississauga, the credit. I don't know if we need to add that, but I don't want to look like we've excluded that portion of the Indigenous community as well.
Thank you for that.
I will put the long form in there when we formalize the resolution to be sent.
Thank you, Nicole. So now we can all take a minute just to read this, make sure that we're happy with this. And then Member Martin will ask for your formal motion for that in a seconder. So Member Martin, does this, are you prepared for this as your motion?
Yep, looks great. Thanks, Madam Chair.
Seconder, please. And I'm trying to find all my faces here. Do we have it? Thank you, Member Huffman. All those in favor? Okay, thank you all for that. Okay, that's carried. So we'll move on to program reports and new business and 7.1 healthy communities report here. I see we'll have Deanna and Jackie Wood speaking to this. So whenever you're ready, feel free to go ahead.
Sure. So good morning, Chair, and through you to the board. My name is Jackie Wood, and I'm the manager of the Population Health Assessment and Quality Assurance team and the Planning and Evaluation team. And joining me is my colleague Deanna Wren, manager of Healthy Communities. So our report stands as written. As we've already highlighted the food insecurity report and primer, which is within the chronic disease prevention portfolio. We'll just focus on a few key additional accomplishments for 2025. So just starting with built environment. As you're likely aware, the built environment plays a significant role in shaping health by influencing opportunities for physical activity, access to healthy food, social connection, safety, and overall well-being. Thoughtful planning and design of the built environment can help prevent chronic disease and injury. So our internal built environment working group, which is comprised of different disciplines, including health promoter, dietitian, and public health inspector, provided input on 14 development applications in Norfolk and Haldimand counties last year. So this work helps to ensure that new developments support healthy, safe, and sustainable communities. We also supported 5 schools in planning and implementing strategies to improve the built environment, promote active transportation, and reduce injury risk. This included partnering with daily school routes to conduct family surveys, complete observation walks, and identify school walking routes and primary modes of travel. So together, these initiatives are just a couple examples of ways to strengthen physical environments that shape health in our communities. And I'll hand it over to Deanna now.
Complementing our work on the physical environment, we also focused on strengthening the social environment and community connections that are essential to health and well-being. The community health brokers implemented 13 social recreational programs in the Brantford Brant community. The goals of these programs are to decrease social isolation, increase the sense of community well-being, provide healthy lifestyle information and referrals to health unit programs as well as community services. Evaluation findings indicated that the majority of the participants felt welcome, experienced a sense of belonging, formed meaningful relationships, and reported an improvement in their mood as a result of attending the programs. As we move forward in 2026, we will continue our overall approach to addressing chronic diseases and injury prevention by using a comprehensive health promotion framework. This approach prioritizes collaboration with community partners to build healthy public policy, create supportive environments, strengthen community action, and support individuals and families. Our efforts will continue to focus upstream, targeting the underlying risk and protective factors that shape health outcomes across the lifespan. By addressing the social, economic, and environmental determinants of health, we aim to reduce inequities and improve population health outcomes. Thank you for your time, and we would be happy to answer any questions.
Thank you for your report. Any questions from members here? Member Martin.
Thanks, Madam Chair. I noticed that in Brantford Brant specifically, under healthy living and well-being, that the social rec programs are poorly attended. What constitutes the social rec program, and like how do we better support those?
Through the chair to Member Martin, So these social recreational programs are in actually priority areas. So we don't expect the attendance to be huge because we are targeting folks that typically we go to them. So we are in apartment buildings. We go to Friendship House. We're at Rosewood Shelter. So we're going to them. So we don't expect a huge turnout. It's not a community event. So I think we're making an impact. It's not at a population level. It is more at a group level. And I think our report does indicate that they are benefiting from the programs. It may look like it's a small number because they attend regularly. So they're not one-off programs. They're programs that continue, often weekly. And that's an average number of attendees per week that we captured.
And are we going to them because they're not able to attend elsewhere, or if we were to have like a combined social event where we could maybe get our numbers up weekly, like would those folks not be able to participate? Okay.
Through the chair to Member Martin, yes, correct. They do have accessibility issues, a lot of them, and they likely wouldn't attend. Sometimes it's transportation, and also we do bring food to the groups to bring them out because often the folks that we do see do have food insecurity issues as well. So we're really impacting the group that is most affected by the social determinants of health and who have least access to general programs in the community.
Okay, thanks for that. And Madam Chair, I forgot one follow-up question on the last report that was not specific to the recommendation. So between the two of us, can you try to remember to come back to me at the end of this discussion? I forgot. Thanks.
So we have Member Bell and then Member Huffman with questions.
Yeah, thank you, Madam Chair. Through to our two presenters. You put a focus on getting people together. How are we using our social media platforms to reinforce the messaging that you're trying to bring here?
Through the chair to Member Bell. Yeah, we continually use our social media platforms. So we often have messaging related to mental health, the importance of social connections, of social health on a regular basis. In addition, we also do take out meta ads, which target specific groups. For example, youth would be one of the populations that we would target with mental health messaging. Healthy lifestyle messaging is more adults. However, the folks that we are targeting with the social recreational programs, a lot of those people would not be accessing social media. So this is why we have multiple strategies to reach people. Social media is good for the general public, but not for those that are our priority populations or are affected more so by the social determinants of health.
And a follow-up question, do you feel like you get enough support from the municipalities who do have many programs running with young people, with seniors, some people that may, as you say, may not be connected to our social media?
Yes, actually, we have a great partnership with both the city of Brantford and the county of Brant in Brantford Brant to really we're targeting folks. The Grand Area Public Health is targeting folks that aren't commonly going to those other programs, and that's why we're going to them. So the city of Brantford, we actually have several programs running in city housing apartment buildings. And so we do have a direct partnership and a relationship with them. They've been very supportive of our programming.
Good. That's good to hear. Thank you.
Yeah, you're welcome.
Member Huffman.
Thank you, Chair. Through you, excuse me. I don't have a question. I just want to say again, excellent work. one of the things that I experienced in over 25 years of social services is the inability for people to step outside the box and bring the programs to the priority population. It is vital that we continue this work. It's not number based. It's a fact that we need to get to where they are so that they can participate. And even if we're reaching 1 or 2 individuals a week, and as you said, as you mentioned, maybe assisting with some food insecurity issues, hats off to you and all the staff. So thank you very much for your work.
Thank you.
Thank you, Member Hoffman. And any other comments from members? So I'll call the question then. Can we have a motion to receive this report for information purposes? Member Bell there, and seconder. Member Bodnar, thank you. All those in favor?
On camera
That's
here.
carried.
You are.
So, and then Member Martin, you had a follow-up question from the last report?
Thanks, Madam Chair. I can't trust my memory these days. Yeah, just a question for Sarah and Jason. Page 30, this report includes a land acknowledgement. Did I miss something?
Through the chair, we'll have to take a look at that. Yeah, we'll look at that and get back to you.
So I didn't miss anything. We didn't pass one. We didn't. Okay. Thank you.
Thank you. And so now we'll move on to 7.2, organizational and financial merger process report. Welcome, Brad, here. And go ahead when you're ready, Brad.
So good morning through the chair to the board. It's our pleasure to be here. We're here to provide an update on the merger. So as you know, GEPH was established on January 1st, 2025, and is undertaking a 3-year journey. Our update today pertains to year 2, quarter 3. So what have we done and how are we doing? As noted in the report, there are many strengths of the merger. Internally, we continue to function with our work streams to focus on specific operational domains, and staff are satisfied with the level of communication about the merger. We have aligned major corporate functions, including IT, and we've assembled the necessary committees, such as Together at Work, to drive our integration forward. Program harmonization is ongoing, and we're working hard to complete current state assessments within our programs, merge databases, align MOUs, and develop program manuals to ultimately inform the future state of our programs. Overall, internally, we continue to expand the quality of our work, find efficiencies, and staff are feeling integrated. For our community, we have a bigger network of staff and community partners to pool resources, share learnings, and share best practices. Key public-facing documents have been aligned, and we're already observing improved communication with our healthcare practitioners. Our unified communication and timelines for ISPA ultimately improves the experience for our school boards, our students, and our families. Our new aligned dashboards allow for community residents to gain a better understanding of respiratory risk in real time. Overall, we are working hard to balance rural and urban priorities, develop a cohesive and unified community for all of our GEPH programs and services. Lastly, we have strong partner relations with our ministry as a principal funder, and we look forward to their continued support. On that note, I'll turn it over to Brad.
Thank you, Hillary. The report also contains a table that outlines the year 2 ministry approved budget and expenditures up to December 31st, 2025 for each of the categories. noting that there are still significant expenses expected for year 2 up to March 31st of 2026, which may be a mix of actually incurred expenses and or estimates or accruals for expenses that we can estimate, and we've cleared this with the ministry and our auditors this practice. Particularly to finance, we've completed one and have another project underway that will improve our administrative efficiency. The first was the purchase and implementation of NetSuite, which has now been fully implemented. This platform serves as our core financial enterprise resource system, replacing an aging, no longer supported platform. NetSuite provides an entirely paperless solution with all previous stored filing cabinet documents available with now just a few clicks. Up-to-date financial metrics such as cash balances and accounts payable, and robust reporting capability and flexibility for managers, directors, and leadership to make sound financial decisions. The second, which is still in the setup phase, is our new Human Resources Information System, which replaces our current HRIS, which currently just does payroll and recruitment services. But the new system will incorporate training and performance management as well. So it effectively replaces a number of the current systems that we use, and implementation of that is expected to be completed in June or July. And with that, Hillary and I are open to taking any questions.
Thank you, Hillary and Brad. Sorry, Hillary, I skipped over you at the beginning there. Sorry about that. I saw Brad's name and I didn't read any farther. Next time I will. Okay, we'll open it up to the floor for any questions from the members. Member Bodner.
Thank you. Through you, Madam Chair. Brad, are the employees of this health unit covered under the Ontario Provincial Directive to return to work? In other words, are there any people still working part-time from home?
Through the chair to Member Bodner, and I'll probably lean on Sarah a little bit for support on this question. We do have staff who are working from home in a hybrid solution, but they weren't. The reason for them working from home is not related to COVID. It's just the general working conditions that we have within Grand Prairie Public Health. So no, it would not likely be covered under the return to work because the reason they are working from home is not related to the COVID situation.
Thank you.
Sarah, did you want to add anything, or you? Thank you. Any other members with questions? Member Bell.
Thank you, Madam Chair. To Brad, I'm looking at your table, the financial highlights table, and there's quite a discrepancy between what we have expended to date and what we're going to hopefully expend. Can you say more about what's going to happen in the next quarter to make up that difference of what looks like nearly $5 million?
Yeah, through the chair to Member Bell. The budget submission, when it was completed in January of 2025, our approach was to be conservative in that we would certainly ask for everything we thought was going to happen or be required to happen related to the merger. So in theory, we probably asked for more than what was necessary. Having said that, there are still a number of expenditures that will actually incur between now and the end of March. So our strategic planning is well underway, and we expect that to be a significant expense. We have harmonized non-union salary expenses, and so we continue to incur that between now and the end of March. And then there'll also be expenses that, again, we can estimate. So to unionize salary harmonization, we know through the Placerta process that might take months and or longer to come up with a resolution. But we have the ability to estimate and accrue those expenses, which we, again, think will be substantial for retroactive to a certain date. After that, we have flexibility with the ministry to, if we have any year 3 expenses that we know we're going to incur and we can incur them now, to incur them now. And that has 2 benefits. One, it ensures we spend the funding we've received, But two, it reduces our year 3 budget ask, which the ministry will find quite palatable, knowing that this is the last year we can submit a budget.
Yeah, I think if I recall rightly, a few months ago, we talked about the ministry pushing back on our request for year 2. We gave a little and then they pushed again and we said, hold on, that, it's as far as we're going. I think for our own credibility in that conversation, it's good that we spend as much as we possibly can of what we fought to get. So, I would encourage, if you can bring forward spending, let's do it. Let's aim to get as close to that 11 million as we can, recognizing that we can give back something in year 3.
And sorry, just to add to that, through the chair to all members, you'll note that there's a line on there for capital, 300,000. That is actually a separate pocket of money through the capital branch of the Ministry of Health, and that is restricted for the sole purposes of our capital planning project that we have underway. So even in year 1, we received funds for capital, and that was unspent money because it is restricted for that purpose. And that will likely be the case in year 2 as well. But the rest, so 11 million minus 300,000 is considered operational merger dollars. And yes, we will do our best to expend as much of that as we can.
Okay. One then specific on governance, which is $250,000, and then we spent $1,000. What was the intent there?
Through the chair to Member Bell, I believe there was a substantial budget there for governance training that I don't think ever really got off the ground. There was also some work around alignment of governance practices, and I believe some policy alignment. So, the 1,000 that was expended, I believe that was a deposit on a hall rental for said event, and said event never occurred.
Okay. Thank you, Brian.
Any further questions?
Madam Chair, is it possible just to throw in another financial related issue at this point?
Sure.
Yeah. So going back to my conversation at the Alpha board with Dr. Moore about budgets, I talked about the fact that the provincial government is only providing a 1% increase, which then has a marked effect on the impact that it has on municipal funding. And I believe that the original 75-25 split has now moved closer to 65-35. And Dr. Moore's advice to us and to the Alpha board in general was, you need to lobby your MPPs and bring pressure to bear through the municipal angle rather than through the Alpha board. Now, I think you have to do both, in fairness. But I would like to propose that our staff bring forward for the board's consideration at the next meeting a review of how budgets, and particularly how the 75-25 split has moved over time and how it's likely to move in the future if things don't change. And then I think we need to think about the message we send via our MPPs to the provincial government to try and lobby for a change, perhaps a restoration of that 75-25 split. I hope I'm not going too far. I'm a way off subject of merger, but it will hit us post-merger. And that's really my concern, that we need to lobby now. We're moving shortly into year 3 of merger, and it won't be very much longer that we are going to be faced with some significant financial pressures if that model doesn't change.
Thank you, Member Bell. And Brad, is that doable to bring some of that forward in a further meeting?
Yes.
Thank you.
Thank you.
And then can I have a motion now to receive this report for information? Member Metcalf, seconded by Member Bodnar. All those in favor? Carried. Thank you, Hillary and Brad, for that and your time in preparing that for us. then we'll move on to 7.3. That's GEPH cash position. And Brad, when you're ready, please proceed.
Thank you. And through you, Chair, this is a verbal update on our cash position that many members were aware of. So we had been experiencing an issue with respect to our cash balances. Despite merger funding being approved in the early fall, and it might have actually been earlier than that, no funds related to the merger had been flowed to GEPH or any of the other merged health units. Additionally, approved one-time funding, the 1% funding increase from the ministry, and funds that were previously directed to the Halban Norfolk Health Unit were not being received by GEPH directly. We are thankful to Norfolk County, who have expeditiously turned around the deposits from the ministry and other provincial health unit funders and have been sending them to GEPH. For a period of time, we were essentially operating with next to no cash balance, needing to ensure that funds from all available sources were flowed to us in order to meet our biggest expense being biweekly payroll. This situation was essentially that GEPH had incurred, as per the last report, merger expenses of close to $6 million, but had received zero funds to cover those expenses. That situation has now been resolved, as approximately 75% of the merger funding was advanced in early February, with the remainder being included in our regular bi-monthly payments. The one-time funding has also been advanced, and all remaining funding issues are expected to be resolved by April the 1st. So now we are in the flip position. We currently have a bank balance of $9.6 million. We do keep all funds in interest-bearing accounts, of which we have two. There's a general account and an investment account that earn interest rates between 1.45 and 1.95% daily, depending on the balance. And we do have a current policy that indicates that the Director of Finance, under the supervision of the CEO, is authorized to invest excess or surplus funds in interest-bearing accounts or short-term deposits. In the future, our consultant is developing an investment policy that spells this out in more detail, including the types of financial instruments that we can be invested in. But in the interim, as a heads up, I'll be working with our financial institution to invest some of these cash balances in short-term GICs, both with and without early cash out options to ensure best return to the organization while balancing current and future cash needs. And with that, I'll take any questions.
Thank you for that, Brad. Any questions from the members? Member Bodner.
Thank you. Through you, Madam Chair, for Brad. Are we going to get an update when we have the Finance and Audit Committee meeting later in the month?
Through the chair to Member Bonner, specifically to investments that were made?
Well, and other items too.
So the Finance and Audit Committee meeting right now, the agenda just has the presentation of by Millards for the preparation of audit plan for this year. We are currently in the middle of wrapping up the 2025 fiscal year with some adjustments to be made this week and getting the auditors prepped on that. I can likely provide a verbal update as to the end position of 2025 at that meeting, as well as an update to cash position if that's what the committee requests.
Okay, thank you. And through you, Madam Chair, I have one other question. Brad, are we still maintaining the $175,000 borrowing limit through the Scotiabank Visa program?
Through the chair to Member Bonner, yes, that increase went into place just recently because there was some snags with the legal name change that had to be rectified before that would be put in place. But that is in place now, and it has been quite beneficial, both through that December period when we had some expenditures, higher expenditures than normal, and we will also again in March related to merger funding. But approaching the $175,000 has not been an issue. That gives us sufficient room for our credit card program.
Okay, thank you, Madam Chair. Thank you, Brad.
Thank you, Member Martin.
Thanks, Madam Chair. I guess my question is, so then we took out of those funds and we reimbursed our municipal partners and other funding partners for floating us for a while there?
Through the chair to Member Martin, we actually didn't have any funds owing to municipal partners. So what we were asking for was
Flow
on
through.
time or as early as possible their monthly or quarterly contributions to GEPH. And then again, Norfolk was receiving our Ministry of Health funding directly. So again, just having that flip to us as soon as possible. We were early on in the merger loaned, I think it was $2 million from Norfolk just as a cash float, and that has been repaid and was repaid quite a while ago, actually. So we currently have no outstanding payables to any of the municipal partners.
Okay, great. So do we expect that this is going to be recurring, like next year's funding? Like for me, totally unacceptable. Totally unacceptable that the province did this to us.
Yeah, through the chair to Member Martin, year one funding actually flowed quicker than year two, which is I don't understand how. I think with the process of approving the merger budget likely to not occur until summer or early fall, there might be the potential of this happening for 3, 4, 5 months, which is not a dire situation for us. But if it does happen again, that we're looking at February, so 10, 11 months of expenses before we see any funding, that will cause an issue. And yes, that would be a problem.
Okay, you'll just keep us posted, I guess, nice and early if we need to start banging the table. Not
Yeah, they framed it as the approval process had system issues, and there was, then they sent the payment and something happened technically that the payment didn't actually get processed. So there was a few different reasons as to why funds were not flowed. And it appears that at least the technical piece has been sorted out. So hopefully next year it's much more streamlined.
Okay, thanks.
Thank you, Member Martin. And then Brad, just a quick question on the process for the investment policy. You'll be bringing that first to the audit committee and then from their recommendation, bringing it forward to the board.
Yeah, to you, Chair. We have a consultant working on all of our corporate services policies, of which that is one of them. But yes, anything finance related, we will bring to the finance audit committee before it comes to the full board. And there's a number of them. They're reviewing our procurement policy, investments, petty cash. Like it's essentially an entire policy manual rewrite.
Okay. Hey, welcome, Member Sicoli. Good to see you there. Any other questions on this verbal report? Seeing none, can I have a motion to receive this as information? Member Huffman, Member Bell seconding, and then all those in favor? Carried. So we're moving on to, there's no committee reports under 8, so we'll move on to consent items under number 9. Everyone has had the opportunity to review those. Any items needing to be removed from there? Member Bell. Oh, you're on mute.
Sorry, can we bring 9.2 for discussion?
Okay. So did you want to start off some discussion points on that, Member Bell?
I can. As I mentioned in the conversation that the Alpha Board had with Dr. Moore, he is promoting the labeling of alcohol and its health issues or its health warnings to be similar to those put on cigarettes, for example. It is coming as a direction or a movement from the Ministry of Health. I personally support it. I've had that conversation around this table before, and I would like that we, as a health unit, are supportive of what Middlesex London Board of Health are doing.
Okay. Any other comments or questions? And then on this one, should we have a motion then first to receive 9.1 and then 9.3 through 9.9 for information purposes, and then we can move forward with a possible second motion to deal with endorsement of a 9.2. Do we have a motion from someone for the consent items? Member Metcalf, seconder. Member Sicoli. All those in favor of the first motion that we have items 9.1, 9.3 through 9.9 as that. All those in favor? Okay, that's carried. And then a motion as presented on our screens for 9.2. Take a minute to read that. Do we have a motion for the endorsement of what Middlesex London Health Unit is doing from any of our
I will move that motion.
Member Bell, is there a seconder? Member Bodnar? All those in favor? Okay, that's carried. Okay, and then from there, we have item 10.1, which is the motion for the governance training options and funding implications. So that was from Member Martin, brought forward that notice of motion, and that was to direct staff to bring forward a report regarding potential funding options for governance training for the executive leadership team. Member Martin, did you want to make that motion?
Sure, happy to move. And as a reminder from the board, this is coming out of our earlier performance appraisal discussions.
Okay, do we have a seconder? Member Sicoli? All those in favor? Looks like, quickly scanning, we've got everyone in favor, so that's carried.
Sorry, Madam Chair, the motion also should include that it's to be paid out of merger funding.
Okay, and so.
Oh, I see. Funding options for, it'll be in the report. Understood.
Yeah. Okay, so that's carried. Forward with upcoming agenda items, number 11. So at our next regular meeting on March 25th, the consultants will be holding a strategic planning workshop with the board. We will also hold our orientation. So this meeting will start at 9 a.m. and it is a mandatory in-person meeting. And if there's any dietary restrictions or any questions, please direct those to our clerk, Nicole, and so that we can get those organized for that March meeting. So we're looking forward to having this orientation. It will be a good time to help with growing as a board. So looking forward that we have that opportunity. There any other upcoming agenda items? Nicole, did you have anything that you needed to add or any?
We've deferred the Healthy Growth and Development Program report to the March meeting just to for time purposes to accommodate as much as we can regarding or orientation and governance discussions.
Okay, thanks for that. Okay, so do we want to take a 5-minute break and then we can move into the in-camera session?
Yeah.
So be back at, I've got it at 11 a.m. and then we'll go from there into our in-camera session. Reconvene here. And then can I have a motion to enter into closed session at 11 o'clock to discuss the items pursuant section 239(2) E, B, and D of the Municipal Act 2001 as amended, because this pertains to litigation or potential litigation, matters before administrative tribunals, and may deal with identifiable individuals. So it's under those sections that we are entitled to go into in camera. May I have that motion? Member Martin, seconded by Member Huffman. And all those in favor? Carried. So can I have a motion to for item 12.1 to receive that as information? Member Bell, Member Martin seconds. All those in favor? Carried. And now for item 12.2, can I also have a motion to receive that for information purposes? Member Bodnar, Member Metcalf seconding. All those in favor? Okay, so that brings us to the end of our agenda. Anyone ready to give me a motion to adjourn? Member Sicoli, Member Metcalf, your hand went up fast there. Those in favor? All those in favor? There's no hesitation there. We are adjourned.